Hi, everyone. This is Illy, and today I am chatting with Dr. Celeste Catania-Opris. She is the owner of Therapy for the Modern Housewives of South Florida. And today she has been kind enough to come on, share with you how you can get your dissertation finished. So this blog post and video is specifically focused to the doctoral student that is, well, you don't have to be in dissertation phase because she's going to give tips that are going to help you when you are in dissertation phase. So Celeste, how did you get interested in this topic?
Well, I personally went through it. So I had to go through the dissertation process myself, and I remember nights of really difficult nights, actually, trying to continue being motivated, feeling alone, feeling lost, and um, and so I thought after graduating, how many people must feel the same way, and that's when I decided to start a group. Um, so it's two groups a month, every month, and it basically allows people who are struggling with finishing their dissertation to come join us and essentially get this support and guidance that they may need.
So did you start, okay, so as part of your practice, you decided,
Yes.
this was a really tough time for me. So let me reach out to this market, so to speak. I don't want to detach it and make it so businessy, but reach out to people who are struggling in this area. Did you start the groups while you were writing your dissertation or after you had finished?
No, afterwards, I actually met with someone in from Nova, and she was having a difficult time with her dissertation. And this is the original, the beginning of it all. And so she was asking me questions because I had finished, and she said, "Thank you so much. This was extremely helpful. You should help other people with this." And I said, "That's a good idea." And that's how that kind of started. So I have a private practice. I see clients on the side, but I also conduct this group once a month, twice a month, and and try to help people in any way I can.
Great. So for those of you not in South Florida, Nova is Nova Southeastern University, which is in Davie, Florida, and they have master's and doctoral programs in a variety of psychotherapy fields. But Celeste and I are both in the marriage and family therapy, I guess officially family therapy PhD program. Okay, so tell us a little bit about the group, what your role is in the group, and what is it structured? Is it more just support? And then also, how is it helping the members?
It's all of the above. So I have this outline that I go through. I created it. It's about several pages typed of the steps. So starting with choosing your committee to choosing your topic, all the way down to you defending your dissertation. And so step by step, I go over because some people come in to these groups and they don't even know where to start. And they've been in dissertation process for a year already.
Mm.
So that tells me that there's something missing here. There's a link missing where people are not, for some reason, that could be personal, it could be they just got married or they just had a child, because these factors also contribute to the progress of your dissertation as well. So you need to take that into consideration too. So if you're being hard on yourself for not completing your dissertation, remember that life occurrences also affect that timeline. So even though your university may give you 4 semesters to complete your dissertation and it takes you several years, there might be other contributing factors as to why that is. So during these groups, I go through these things. I ask personal questions in the sense of what's been going on. Tell me a little bit about your process. And sometimes people don't put it together that you just had your third child and you have a spouse to help around the house, and you have a job and you have 3 kids. Like, these things really do affect that timeline of yours. And so once people are, I guess, recognized, they're recognized for the struggles that they have to deal with, it's kind of like a weight has been lifted. And I've been doing this since October or November, and I've had people who haven't touched their dissertations in years complete 3 chapters in 2 months after coming just to one group. And so that made me realize that this personal attention that I offer each student, because we're still students, really helps motivate people. It's kind of freeing in a way to know that they, to know that there's someone that is there for them, to know that someone, that's the biggest thing I think, is the support. I think people are lacking the support. And once they come to my group, they realize that someone actually cares, because that's, you know, there's so many people who care, but I think that when you're in this process and you're so far into it, you feel really alone. And when they come to the group and there are other people who are feeling the same exact way as them, feeling the same stressors, it really is a freeing experience. And I think that's what helps people, honestly.
So it sounds like, one, it's really important to recognize that life happens and what has happened in your life that is lengthening your timeline, and just being really accepting about that rather than beating yourself up about it. So similar to a therapeutic process, like being able to just give yourself some grace and acceptance and move forward with the support of other people is essential, because 3 chapters in a few months, that's huge.
Yes.
That's huge. So what are some tips that you have for, you know, doctoral students out there that are, you know, getting ready to start their dissertation, or perhaps they're, you know, a perfect candidate for your group, they haven't touched their dissertation in a while, or they're feeling stuck in their writing process? What are some tips that you can offer that can get them motivated again, or, you know, back on the keyboard?
Right. So if you're stuck, lost, need motivation, there's a reason for that. Sometimes it's just not knowing the next step, and that really turns people off, and they'll put it to the side. They'll put the dissertation. Before you know it, months and months have gone by, and then there's a lot of anxiety with that, because you'll see people in your cohort proposing and you still haven't started chapter 1, so it leads to a lot of anxiety. So the tips that I could offer you all is to create realistic goals for yourselves. If there are things going on in your life, some people have come to my group who have taken care of a sick relative, parent, things like that. These things really do affect you personally, emotionally, spiritually, physically. And these factors really contribute to your progress. So take into consideration that know that you're doing the best that you can, because there are outside influences who are affecting this progress timeline, this whole thing that you pictured that was going to be perfect and on time. It might not be, and that's okay, because it's not if you finish, it's when you finish.
Ah, I love that.
Thank
So, sure. I am exactly, and I'm just going to share with you guys, like, this is me. I had a child before I started dissertation, and I'm also doing a very unique dissertation that doesn't follow the regular outline of a dissertation. So it's like writing a book in terms of the creative process. So and I don't feel stuck, but it's slow. It's slow
Right.
because for me, I'm figuring out the answers or the ideas as I write it. So I have found very much that scheduling time, blocking off regular time to just go write, whether I'm feeling it or not, kind of like exercise. And then I always feel better because the juices get flowing, and you can really get into the writing process. So thank you so much for addressing the anxiety and just those little things that I don't think that as we're writing our dissertations we notice are really affecting us. So I appreciate the tips, and thanks so much for your time today, Dr.
You're very welcome.